Long before Kentucky had crisis units, outpatient clinics, or modern mental health treatment, it had institutions. Huge brick buildings where thousands of people lived and many died behind locked doors. These state hospitals didn't just shape the way Kentucky treated mental illness. They shaped the lives of families, communities, and entire generations. And even though many of these buildings stand empty today, the system we have now still carries their imprint. This is where Kentucky's mental health story begins. Kentucky was one of the earliest states in the nation to build psychiatric institutions. In 1824, it opened Eastern State Hospital in Lexington, one of the oldest psychiatric hospitals in the United States. Next came Western State Hospital in Hopkinsville, founded in 1854 to serve the western half of the state. Then in 1873, the state built Central State Hospital in Louisville, originally known as the Lakeland Asylum for the Insane. Later, the former Fort Thomas VA site was repurposed into what became Lakeland Hospital, handling overflow when the system was pushed beyond capacity. These weren't ordinary facilities. They were entire worlds within walls, with their own farms, laundries, kitchens, workshops, and even cemeteries. Entire lives were lived, and often ended inside these institutions. At their peak, Kentucky's state hospitals housed thousands of people, far more than they were ever designed to hold. Life inside these hospitals was complex. Some patients found structure, food, and safety they couldn't get at home. But the system itself was never built for recovery on a large scale. By the 1920s through the 1950s, Kentucky's institutions, like much of the nation, became severely overcrowded. One nurse might be responsible for 40, 50, even 60 patients at a time. Therapy was limited. Most days were built around strict routines: breakfast, chores, medications, quiet time, lights out. Treatments reflected the time period: hydrotherapy, restraints, early forms of electroshock before it became the refined treatment we know today. In some eras, doctors even performed lobotomies, once praised as a miracle cure but now remembered as a painful lesson in medical history. Many people admitted to these hospitals weren't dangerous. They suffered from conditions we treat very differently today: postpartum depression, epilepsy, dementia, alcoholism, or intellectual disabilities. But without outpatient clinics or modern medication, families often had nowhere else to turn. And for many, once they were admitted, they stayed for decades. To understand why these hospitals grew so large, we have to understand the world before psychiatric medication. In the 1800s and early 1900s, families, especially in rural Kentucky, struggled to care for loved ones with severe mental illness or developmental disabilities. There were no home supports, no Medicaid, no community programs. State laws at the time encouraged institutional care. Society believed mental illness should be handled far away from public life. Nationally, the eugenics movement influenced policy, pushing for the segregation of people with disabilities and mental illness. And in Kentucky, large institutions became the default solution, not because they were the best option, but because they were the only option. Everything changed in the mid-20th century. In the 1950s, the first psychiatric medications, including Thorazine and later lithium, made it possible for many people to stabilize outside of institutions for the first time. And in 1963, President John F. Kennedy signed the Community Mental Health Act, promising a new vision for America: smaller community clinics that would replace large state hospitals. The goal was hopeful and revolutionary: treat people close to home, not locked away behind walls. But the promise wasn't fully kept. Across the country, and here in Kentucky, hospitals began downsizing long before the community supports were built. Federal funding fell short. State budgets were stretched thin. Many clinics were planned, but never opened. This gap, the space between the old system and the new one that never fully arrived, is the root of many challenges Kentucky still faces today. Kentucky's mental health institutions were built with the belief that they were the only way to care for people who were suffering. And for a long time, they were. But when the doors finally began to close, the next chapter of mental health care was left unfinished. Thousands of people were discharged into communities that weren't prepared for them. That unfinished chapter is still unfolding today in our ERS, our jails, our homelessness crisis, and in programs striving to fill the gaps. In our next episode, we'll explore the era of deinstitutionalization, a movement built on hope, shaped by politics, and marked by consequences we are still trying to resolve. Thanks for watching, and be sure to subscribe so you don't miss it.